Treatment of diabetes. So first of all, we learn what are the basic essential element in the comprehensive care of type 2 diabetes. Remember, whenever we say type 2 diabetes, I told you in my previous lecture, as in diabetic 95% are type 2 diabetic and 5% are type 1 diabetes. So that's why whenever we say diabetes, if not specified, that means we are talking about type 2 diabetes. So what are the plan? Remember, it is always a individualized glycemic control, and the essential element are diet and lifestyle modification, exercise and medication. Then not only we have to treat the patient, we also have to treat the associated condition like dyslipidemia, hypertension and obesity. And we also have to screen the likely complication like retinopathy, nephropathy, neuropathy, CVS and other complications. So in nutshell, treat the disease, treat the comorbidity and look for the complications. This is the basic of management. So we take one by one. The best initial treatment is patient education. This is very, very important. So-called lifestyle modification. Okay. So the best treatment initially you have to go for the diet and exercise. Okay. Simple weight control can cure or at least control diabetes in around 25 to 30%. It's a huge percentage, weight control. Okay, and they do not need any drug because they just reduce the adipose tissue, and by now you have learned the basic concept. When you lose the body weight, that lead to what? Up regulation of receptor. About this I have discussed in my previous lecture, which I am sure you have seen. If not, see the previous lecture in which I talked about down and up regulation of receptors. Okay. So once the up regulation of receptor is there, that reduces the insulin, I for insulin, resistance, R for resistance. So one of the most important component is weight loss. What, and one more thing, exercising muscle, they do not need insulin. It means what? Even exercise will be very, very helpful in type 1 diabetes where patient is lacking insulin. What else in the lifestyle modification? He is advised to stop smoking. Very, very important line. Control blood sugar, control lipid, right? Why? And control the body weight also. All these are the risk factor for the coronary artery disease. If I ask you, what are the major risk factor for CAD? Diabetes, hypertension, smoking, and hyperlipidemia. Very frequently asked question. So they have to be controlled because they are the risk factor for coronary artery disease, and I am sure you know that in diabetic patient, coronary artery disease is 3 to 5 times more common as compared to general population, and peripheral vascular disease is at least 100 times more common as compared to general population. Okay. So a reduced weight to normal, maintain normal BMI. What is normal BMI? We talk usually is what is BMI? Body weight in kg divided by height in meter square. This is normal BMI we talk about, and when the normal BMI is less than 25, more than 25 is overweight, 25 to 30 is overweight, more than 30 is obese. When we say more than 35, it is morbid obesity is there. Now I have a question for you. You listen to question, stop the video, after listening question, write down the answer and check it. It is true that increased BMI is bad. but very low BMI also is also very bad. Tell me below how much BMI in male, BMI less than how much is fatal in males, and how much BMI less than BMI how much is fatal in females. Stop the video, write down the answer. Well, I am sure you must have written the answer by now. Below 13 in male is fatal and below 11 in female is fatal. It is so that my so-called some ladies which are very keen in losing the body weight, so-called they want to go for zero figure with a tend to lose the body weight. It's too much body weight loss is again bad, but at the moment as we are talking about diabetes, high amount of BMI is bad. Patient should be always told to advise that lose the food of, he should avoid food of high glycemic index. Now again before I proceed further, let me tell you what do you mean by food of high glycemic index. Okay, let's talk about two things. One is starch, potato, and other is sugar. If I ask you which of the following is the food of high glycemic index, potato or glucose or sugar, whatever I can write glucose for a better clarity. The answer is glucose. Now what do you mean by food of high glycemic index? Why not potato is a food of high glycemic index? Let's learn the basic concept. The basic concept goes like this. When we eat potato, it contains starch, it goes to stomach. In the stomach it remains for 2 hours, and because gastric emptying time is 2 hours. After 2 hours it comes to intestine and now digestion occurs and the glucose is absorbed and like this. The blood sugar goes like this. But glucose is the ready-made sugar, it gets absorbed in stomach, and once a person take glucose, immediately blood sugar rises because glucose is the one food element which get absorbed in stomach. So it tend to rise the blood sugar very fast. So when we talk about food of high glycemic index, how fast, how quickly a particular food can raise the blood sugar is what we call as glycemic index, and 100 is for glucose. Glucose is the food of highest glycemic index, right? So now extra edge question for you. Remember, glucose is the one food element which get absorbed in stomach. Write down the answer, a question for you. What are the other food elements which get absorbed in stomach? Well, the other food element, I hope you have written the answer. The answer is water and alcohol. These two are get absorbed in stomach only. That's why when a person take a large amount of alcohol, he get intoxicated very fast. The reason being it's the alcohol get absorbed in stomach only. Okay. Well, I hope you are clear about the food of glycemic index. Now let me give you a chart indicating food of glycemic index. The chart is there. Well, 100% is for glucose. Then cornflake, carrot, potato mash, they are high, and soybean, groundnut, they are food of low glycemic index. We say food of high glycemic index when it is more than value is 70. So that means in that way these are all the food of high glycemic index. So anything which is above 70 or 70 onward is food of high glycemic indexes there. Now I have a very easy question for you. Again, write down the answer. Well, the question is, we all know 1 gram of protein give you 4 calories, carbohydrate give you 4 calories, fat give you 9 calories, 1 gram. Now the question is, how much calorie we get from 1 gram of alcohol? The options are as follows. The question is, how much calories we get from 1 gram of alcohol? I give you options: 13.6 calories, 11.02 calories, 9.11, 7, 5.20, 3.12 and 0 calories. You can stop the video for a second, write down the answer quickly. Well, I'm sure you have written the answer. Well, the right answer is 0 calories. Have you written the answer? If yes, raise the hand. Well, 0 calories is the most common wrong answer. The answer is 7 calories. 1 gram of alcohol gives you 7 calories, and believe me, this point is not known to most of students. It's a very frequently asked question. Well, let me tell you some lighter aspect of the diabetes. If alcohol was a 0 calorie food, in fact, the only 0 calorie food is water. Only 0 calorie food. That's why the top models who have to maintain the 0 figure, they are asked to drink only hot water, and that gives a sensation that the stomach is full, because they have to maintain the figure to up to dot. Those who go for Miss Universe or Miss World. Okay. Well, if I say if alcohol was a 0 calorie food, then I would have opened an slimming center. Okay. Then in my office it would have been written Dr. Bhatia Slimming Center, and here and under that I would have written here I'll treat your obesity by giving alcohol. यहाँ पे आपके मोटापे का इलाज दारू पिला के किया जाता है. So well, I would have been sitting in the OPD, a very obese man come in the morning at 9 o'clock. What I would have written, treatment. Remember, if alcohol was a 0 calorie food, I would have written treatment. 1 bottle of Kingfisher beer or any other beer in the morning at 9 a.m. The patient would have said, oh doctor, 1 bottle is not enough, this is for morning, write something for evening also, make it BD or TDS. Patient will compel me to write TDS. Okay. And I would have become a famous doctor, the doctor who prescribed beer. Well, patient would have been very, very happy, but I am so sorry to say that it contains 1 gram of alcohol give you 7 calories. That you have to remember. It's a very frequently asked question. I hope you are refreshed also because you must have been tired by now. So now let's talk about how much calories is needed. I'm given a very simple formula for you. Sedentary, we classify into 3 categories: sedentary, active and very active, depending on obese, normal or underweight kg. Those sedentary 25, 30 and 35 is a simple formula to remember. And here 30, 35, this is 35, 40, 40, 45. It's a very rough but very practical formula. Okay, very practical point. This you can approximate calories requirement is there. Other way around, we also say that patients should lose the body weight to maintain ideal body weight. For a man, how we calculate? Again, a rough formula. Body weight, body weight. How much the ideal body weight? Height in centimeter minus 100. Suppose there is one gentleman who is 170 centimeter minus 100. His ideal body weight for a male is around 70. Again, a very rough formula, but very practical formula for those who are doing practice. Well, I'll lie one thing more: yo-yo dieting. What happened? This is known as weight cycling. Weight cycling. Let me tell you. Patient come to you, maybe diabetic or non-diabetic, especially maybe young lady, obese lady. She come and you ask, give a dietary advice. She says yes, she is obese. She will follow your diet advice for a few days and she will lose the body weight like this. For maybe a month or 2, she is following your diet, she is losing body weight, but again she come back to normal diet, heavy diet. She gain weights, comes here. Again she come back to you, you advise, she goes like this. Again she goes like this. So what we have? Cycling. She will have a increase weight, reduce weight, increase weight, like this thing. Cycling is there. This is so called yo-yo dieting. Yo-yo dieting. What is the main reason? Patient get convinced to lose the body weight, but soon they forget is the reason why they go for yo-yo dieting. Now, having done the basic groundwork for the lifestyle modification, now we start medication. So first we start with oral medication. The first drug, of course, for type 2 diabetes is always metformin. It is the drug of choice, best initial drug, beyond doubt. Why? It has got anorexic effect. Okay, so it causes loss of body weight, and by now you understood the importance of body weight in type 2 diabetes, and it causes increased peripheral utilization of glucose. It also reduces hepatic outflow of glucose. That means reduce glucose release from the liver. So it blocks gluconeogenesis, but it does not lead to hypoglycemia, a very big advantage of this drug. Okay, but little bit side effect, it can lead to nausea, diarrhea, but not a very common side effect, and uncommonly it can lead to lactic acidosis, a very commonly asked question. These are very commonly asked questions. Okay. Well, one more advantage of this, it does, but it should not be used, since it can lead to lactic acidosis, so should not be used in renal failure, liver failure, should not be used in alcoholic patient also, because these are patients who are increased risk of lactic acidosis themselves, and it should not be used in serious illness like septicemia. Prolonged use can lead to vitamin B12 deficiency, very commonly asked question. And one more advantage, metformin therapy does not need plasma monitoring because it does not lead to hypoglycemia. So there are very important questions that you got to remember in this particular condition. Second drug is sulfonylurea. What are they? They are insulin secretagogue. What do you mean by insulin secretagogue? Let's learn the basic pharmacology. Here is the pancreas. Here is the beta cell. It contains insulin. Sulfonylurea comes, get attached to receptor, and it causes release of preformed insulin. So any drug which causes release of preformed insulin is, or any substance or drug which causes release of preformed insulin is insulin secretagogue. Now a question for you. Tell me, what is the best insulin, which substance or drug is the best insulin secretagogue? Stop the video, write down the answer. The answer is glucose. Glucose is a naturally occurring compound. When we eat starch, get digested, converted into glucose, come to receptor, it causes release of preformed insulin. That's why the insulin level is minimum at fasting, and after breakfast insulin rises. Why? Because of glucose. Okay. Well, they can cause hypoglycemia. Remember, metformin therapy never led to hypoglycemia. We classify into different categories. Short acting is tolbutamide, gliclazide, medium acting, long acting glibenclamide, chlorpropamide, glyburide and glyburide. It has got maximum highest affinity. For the beta cell out of all these what I have written. Then we have third category drug is thiazolidinedione. They increase insulin sensitivity. They act on the nuclear PPAR gamma receptors. Okay. But this drug we can also use in PCOS, and we can also use in non-alcoholic fatty liver disease. Advantage, they do not lead to hypoglycemia. Now I have very important question for you. This is a very important question. PCOS, they are important question you got to remember. The question is, we have one ARB. ARB is angiotensin receptor blocking drug. Which ARB can act on PPAR gamma receptor? Stop the video, write down the answer. The answer is telmisartan. Is the only ARB which can act on the PPAR gamma receptor also. Is a prospective new question for you. Well, what are the side effects of these drugs? They tend to retain sodium in water, so they can precipitate congestive heart failure, hypertension. That means they are not suitable for cardiac patients. In cardiac patient having some coronary hypertension, CHF, they should not be used. They are known to cause hepatotoxicity. They can lead to bone fractures. Recently reports have come, they can lead to bladder carcinoma also. Example are pioglitazone, previously there was a drug rosiglitazone, it has been withdrawn from everywhere. Even this drug is getting banned in some of the countries, but at time it is available. Since most of textbook they mention about this drug, so I am mentioning, but local regulatory authorities are different, but it is there. Alpha glucosidase inhibitor, example are acarbose, miglitol, voglibos. They reduce breakdown of starch in the GIT. So this is the stomach, intestine. It is these drugs are taken just before the food intake. They will inhibit the amylase. As amylase will not be able to digest starch, so food will go. Most of the time, it is absorption is slowed down, or so slope of the absorption of sugar will be low down. Okay, and they are especially very good drug for postprandial hyperglycemia. What do you mean by postprandial hyperglycemia? You will be getting some patient. He say, doctor, before breakfast, before lunch, and before dinner, my sugar is normal. But after 2 hours of the meal, breakfast, lunch, dinner, sugar increases. In such cases, they are very good drugs because they are good, inhibit the enzyme amylase. So they slow down the absorption of, suppose the normal absorption of glucose like this, they will make the flat. So slower absorption of sugar, the sugar will be controlled, especially in postprandial hyperglycemia. And they can reduce the HbA1c by 0.5 to 1%, but should not be used in gastroparesis, which itself can be a complication of diabetic autonomic neuropathy. They should not be given in inflammatory bowel disease. Okay, they should not be used. And the side effects are flatulence, or you can say abdominal distension and pain, and sometimes they can lead to diarrhea also. But flatulence is a big problem because starch is undigested. Now we have one more category of drug, meglitinide, which include linaclotide and repaglinide. They are also act on the sulfonylurea receptor binder. That means we can say they are also insulin secretagogue. I mentioned to you about insulin secretagogue when I discussed sulfonylurea. So they also cause increased insulin release from the beta cell the way sulfonylurea do. That's why a commonly asked question that which drug should not be combined with sulfonylurea, answer should be these drugs because both have the same mechanism of action. So action mimic like sulfonylurea, but advantage they do not contain sulfur. This is a big advantage because those patients who are sensitive to sulfur may sometimes react to sulfonylurea, but they are sulfur free. But one more advantage, they are again very good for postprandial hyperglycemia the way alpha glucosidase inhibitor were useful. Why? because they have a very short half life. So that's why again postprandial hyperglycemia, and especially in those patients where they have a erratic food habit due to work job profile where they can't have fixed meals, they are very useful. Okay, so they have very role in this type of patients. Quick recap. टाइम नोट कर लेंगे. और इसको यहां से शुरू करेंगे. A quick recap of the last minute revision point. Metformin is the best initial drug for type 2 obese diabetic patient. They have an anorexic effect. Vitamin B12 deficiency can occur due to long-term use. They can lead to lactic acidosis. Sulfonylurea, they are insulin secretagogue. They cause release of preformed insulin. Thiazolidinedione, they act on the PPAR gamma receptor. They can also be used for NAFLD and PCOS. Can precipitate heart failure, can cause bone fracture, can lead to bladder cancer. And telmisartan is the one ARB which can act on the PPAR gamma receptors. Alpha glucosidase inhibitor, again very good for the postprandial hyperglycemia. They reduce the breakdown of starch, so they make this flat, slow absorption of glucose. And megliteinide, again insulin secretagogue. They act on the sulfonylurea receptor, but they have a short half life. They do not contain sulfur. So ideally again for the postprandial hyperglycemia. Thank you very much for watching this video.